Hi everybody, this is Michelle Lewis with Siouxland District Health Department. This month for our CHA chip update, we will be focusing in on the STI priority area. As you can see on our slide here with the data, we are looking specifically at syphilis. And in 2020, we had one case. Prior to that, we really had not very many, if any, cases. Then in 2021, 2022, 2023, you can see that our cases grew quite rapidly over those years. So we really wanted to start focusing in on different things that we could do to address syphilis. And as you can see, the numbers did drop in 2024 thanks to a lot of different initiatives that the STI Coalition worked on. However, one thing we want to kind of point out that is unique to our area, you can see there on the far left graph there, in Woodbury County, the individuals that test positive for syphilis is split, 50% females and 50% males. What is interesting is that other larger communities in Iowa and or across the country, typically those that are testing for syphilis is still in the men having sex with men population. So being that we have 50% of our population are females, we do have the high concern or the risk of congenital syphilis, which is when a pregnant woman passes that infection to her fetus during pregnancy or childbirth. Like I said, as you can see there on the chart, in Woodbury County, we have had 12 of those cases from 2020 to 2024. Nationally, 2 in 5 or 40% of babies that are born to women that are infected with untreated syphilis do die from the infection, so that it is a very serious concern. And so that is why here, like I said, our focus area has really looked at what can we do to prevent the congenital syphilis. And so we have worked very closely with our providers, and so we are doing testing early on in their prenatal visits, and then later on, and then again at birth at the hospital. However, like you can see, we still do have some positives reported in the county. So one initiative that we are trying is through our WIC office here at Siouxland District Health Department. This is the Women and Infant Children program where people come in for nutrition education and vouchers. What we're doing is we are screening all females that come into the WIC program. So when they're coming in for kind of like their pregnant pre-certification type appointments, we are screening them and simply asking if they have seen a provider for this pregnancy. If they have not yet seen a provider, they are then referred to one of our STI clinicians to just kind of basically visit with and share the importance of obviously seeking out prenatal care, but also the importance of testing for STIs during pregnancy. If that female agrees to having an STI test, we then provide the testing right then and there at the end of their WIC appointments. If the test does come back positive, then we have our nurses, our clinical staff that then begin kind of the case management, which is the treatment of the infection, calling potential partners, and that type of thing, and then also referring these individuals in for maternal health care to get in to see a provider. So since January, when we started this pilot project, we have had 77 pregnant appointments that have been classified as pregnant individuals. Of those 77, 26 qualified to be screened or referred to STI testing, meaning that 26 of them had not yet been seen by a provider for this pregnancy. Of those 26, 16 had agreed to get testing. And then of that, we have had some positives. I am not going to share the number and or what they tested positive for, but that we have had some positive tests. So we will continue on with this pilot project just to kind of see how it goes, but it does show the urgency or the need for having this opportunity, especially for those that have not yet sought prenatal care or do not plan to seek prenatal care. So I just want to finish up here, just kind of reminding people that they're more than welcome to join us for our STI coalitions. Our next meeting is Thursday, May 22nd here at the Health Department. Brandy Steck is the facilitator of that meeting, and she is from the Title X program over at Siouxland Community Health Center. So thank you.